Can IGRA tests alone diagnose active TB disease? Can Interferon-Gamma Release Assays, or IGRAs, be used on their own to diagnose active tuberculosis? The answer is no. While IGRAs are helpful tests that measure the immune response to Mycobacterium tuberculosis, they cannot definitively diagnose active TB disease. Instead, they indicate whether a person has been infected with the bacteria, which could be either latent or active TB. IGRAs have a moderate level of sensitivity and specificity when it comes to diagnosing active TB. The pooled sensitivity of these tests for active TB typically ranges from 64 to 77%. This means that they may miss about 25 to 35% of active TB cases. On the other hand, the specificity of IGRAs is around 78 to 87%, which indicates that some false positives can occur. The accuracy of these tests can vary based on the population being tested and the clinical setting. For instance, in individuals living with HIV or in areas with a high burden of TB, the sensitivity tends to be lower and false negatives are more common. When IGRAs are performed, they measure the releases of interferon gamma from T cells in response to specific TB antigens. However, this immune response can occur in both latent TB infection and active TB disease. Therefore, a positive IGRA result shows that there is a TB infection but does not confirm that the disease is active. Conversely, a negative IGRA does not reliably rule out active TB, especially in people who are immunocompromised or those with extrapulmonary TB. Because of these limitations, diagnosing active TB requires a more comprehensive approach. This includes integrating IGRA results with other diagnostic tools and clinical information. For example, microbiological tests, such as sputum smear microscopy, culture, or nucleic acid amplification tests, are essential. Radiological imaging, like chest X-rays or CT scans, is also crucial, along with assessing clinical signs and symptoms. In some cases, additional tests on cerebrospinal fluid or other body fluids may be necessary for diagnosing extrapulmonary TB. In summary, while IGRAs are valuable for detecting TB infection and identifying individuals at risk for developing active disease, they cannot be used alone to diagnose active TB. A thorough diagnostic approach that combines immunological, microbiological, radiological, and clinical data is necessary to confirm active TB. This aligns with the guidelines from major health authorities such as the World Health Organization and the Centers for Disease Control and Prevention. Always consult healthcare professionals for personalized medical advice regarding TB testing and diagnosis.